Are you a leader who are looking to create more personalized medicine and personalized care to your patients and your community? Stay tuned for this episode where we interview our expert speaker, Dr. Monisha, who is a board certified physician with multiple subspecialty and a wellness advocate to share with you the major points on how you can create better personalized care to your patient, as well as building a business that truly aligns with your passion.
Healthcare entrepreneurs, are you ready to rewrite the rules for your business so you can have more time off, a great team, and more income while creating a positive social impact? Then you are in the right place. Welcome to The Provider's Edge. I'm your host, Sabrina Rumbach. I'm a provider, an international peak performance keynote speaker, and a best-selling author. Let's open the gateway to profitability for you today. My guests and I help healthcare entrepreneurs and startup founders like you break through barriers so you can control your business, control your life, and control your future. This is your defining moment to be a disruptor in healthcare.
Welcome to another episode. This is your host, Sabrina Rumbach, and today I am excited to have Dr. Monisha Bhanote with us. She is a best-selling author and one of the very few quadruple board certified physician in the nation. And she combines the ancient wisdom with mind, body science to naturally biohack the human body through her expertise in cytopathology, functional culinary medicine, specialty, integrated medicine. And she's known as the well-being doctor. She has been able to diagnose over 1 million cancer cases, provide health programs through her drbhanote.com, and leads wellness workshop and retreats worldwide, and featured in Shape, Reader's Digest, and Martha Stewart Living. And Dr. Bhanote serves in several clinical advisory boards and is the go-to health and wellness expert in Healthline, Psych Central, and Medical News Today. So I'm so excited for you to be here.
Thank you so much, Sabrina, for inviting me on to the Provider's Edge to talk with you and your community.
Yeah, we initially hit it off just by chatting about each other's work. And then she has been able to have this unique passion and being board certified in so many different subspecialty and bring it all into one thing that makes sense cohesively for herself and for all the other providers she's working with. So I would love for you to dive a little bit deeper in the background of how did it all come together? Like, what did it all start? And then is there any moment in your life that you're like, there's a light bulb moment that you can do it all, but in a more cohesive way and not to get so scattered for people who have so many different passions?
Yeah, great question, Sabrina. It's been quite a long journey. This didn't happen overnight. I'm a conventionally trained medical doctor and went down the route of treating patients with their chronic diseases and then going, all right, this just inherently doesn't feel right. I'm seeing them every couple months coming into the clinic and I'm just giving them some medications and nothing's getting better. And it just didn't sit right with me. It wasn't good for them. It wasn't good for me. So then I'm like, all right, what can I do that I can help a lot of people and still fuel my passion for learning? So I delved into pathology, which is really the study of all diseases. Like, how do diseases develop? What do they look like in our body? What is happening to our body? And I spent so much time diagnosing disease where it was just one disease after the other, and sitting in conferences and tumor boards talking about these patients where it's like, all right, they have cancer. Let's cut it out. Let's give them chemo. Let's radiate it. Let's zap it. And then I'm like, hello, where's the person in this? Like, where does the person have some ability to have an impact on their health? And there is a lot of misinformation out there about, oh, I don't have cancer in my family, I'll be fine. Or my genetics is good, I'll be okay. But when 95% of cancer is not necessarily the genetics you are born with, but the mutations that you develop over time, that means there's something we're doing in our lifestyle and how we're living our lifestyle that impacts it. And if we actually understood that, wouldn't we want to influence it in a good way? So I spent a lot of time delving deeper into the research and realizing that it's a lot of our lifestyle and getting more of an understanding how our lifestyle impacts our cellular health and the development of disease. And that's kind of what led me to what I do today, which is I've combined a very unique medical practice with my background in diagnosing disease from one end of the spectrum to how can we actually prevent it with our lifestyles.
Exactly. It's about looking at people more in a whole of we're not just focusing on the disease itself. And once people got this diagnosis, then let's do something about it. And then it's really too late. How can we take a more proactive role of thinking about medicine altogether in a different light and not feeling like, well, when we manage the disease, it's not really because they're chronic disease. So it's not going to miraculously just transform on itself by having pharmaceuticals. Yes, they have advancement on its own, but that shouldn't be how we default in thinking about what medicine could be. And so it's exciting for you to go on this path. So when you start thinking about adding on to different subspecialties, and how do you decide where to pick up, or how to seek out, and then what really can make sense for us?
Yeah. So I think, life in itself is an experimentation. And I've spent a lot of time in the laboratory where it's all about experimenting. And that's kind of how I see how I built the practice, in the sense of I experimented with mindfulness practices and meditation and saw what a difference they can do to my own well-being, that why would I not incorporate them into my healthcare practice? Or my own practice of yoga, and how that increased self-awareness and made me in tune with, all right, what does my body actually need for the day? How can I fuel my body in a more intentional way? So really, it all delved from my own experimentation and trying things out, and then going, all right, well, this works for me, but it doesn't work for somebody else. So what else is there? So that's where, understanding the DNA and what you're born with, your genomic makeup, and how to optimize that so you're functioning at your best. And it really just went on from there. And as I delve deeper and deeper, it's like, all right, we know nutrition has a greater impact, but what is the nutrition that my specific body thrives off of? And that comes all the way back to self-awareness, which a lot of people aren't self-aware. They just think, all right, my headache is normal. Everybody gets a headache, or my constipation is normal, or bloating. This is all normal. No, it's not normal. It's your body is communicating with you, and it's communicating with you through your cells. So when I say that your cells are angry, that's when you're getting symptoms. So they're talking to you. And you're not seeing them at the microscopic level. I've been seeing them at the microscopic level for a very long time. And boy, do we have some angry cells out there. We definitely do. So it's up to you to kind of understand, all right, what is my body saying? And then work with the right provider who can help you translate that into a way that's going to be good for you.
Right. And then on the flip side, I think your best genius in that is you're willing to try, you're willing to explore. I think our providers sometimes, when we have established a business or our practice in certain ways, then sometimes it can be like stuck in that way of how we run our practice because we've been doing that for so long. And sometimes we limit ourselves into our own capacity of seeing beyond what we do day to day. It just maintain it for so long, but it's not going to get you to the next level. And it's actually holding you back from having more impact, having more profit, and having more satisfaction from your whole team. It's at the end of the day, it's what you said, so true. Even how I see it with my client is that the more we are self-aware of the good and bad, and then where we actually want to go, then we can allow ourselves to freaking stop for a minute, right? And I thinking about all these other possibilities instead of become the resistant of, well, no, I'm still needed to do so much for my team. Or no, my patient need me in this direction. I can't even think about other possibilities for me to work better or for me to work better with them. And I think that could be a big struggle for some people. However, there are also many people are in the position of, I already hit a wall. So if I don't change, nothing else will change. And that's a great point for someone to perhaps talk to you to figure out what that model could be in their business. Would you say, what are some common challenges that you're seeing for the practitioners that you have been working with?
So part of it is you have to have a curiosity. What I learned 30 years ago in healthcare has changed so much. So if you're not continuing to learn and kind of be very open-minded, because healthcare can be, oh, this is one way, here's the protocol, and this is what we're going to do. This is the, diagnosis the person has been given. But the reality is that doesn't work for everybody. And that's why, as a practitioner, being able to expand your knowledge, being open to it, and also being like, okay, this might not be something I do, but then working with other practitioners and kind of building your own team of practitioners that you can work with. If you're still prescribing the same cholesterol medication and the same, high blood pressure medication from 30 years ago, and not looking at the potential of what lifestyle, nutrition, exercise, botanicals can do, then you're really missing the picture of what potential you have as a provider, as a practitioner, as a healer, as a doctor. So I think you're holding yourself back from being the best doctor, because I know at the end of the day, doctors, their purpose of going into this really was to help people. And now they're stuck with the system that is telling them you have to see more patients, you have to do this, you can't do this surgery because that's not going to bring in more money for the hospital. But at the end of the day, you're a doctor. So if that doesn't work for you anymore, build your practice. Do what's going to make you happy. That's how you avoid that potential burnout that everybody's experiencing. The burnout is really coming from not that we're doctors and we're doing this and that. It's because we're not following what our true passion is and what we want to do. So get creative. We are living in a time where anything is possible if you're willing to kind of step out of your comfort zone and go, all right, I need to relearn a few things, and it's going to be a little challenging in the beginning. But when I do step into that, I'm going to live a much better life. I'm going to be happier with, what I'm doing every day. You're going to wake up and be like, oh, I get to do this. I get to see these patients. I get to provide them the care that I want to do.
Right. It's that moment of curiosity of, I get to do this. I think that's the mental shift we all have to focus on, is that if we feel like that there's nothing we can control, there's always just the set ways, then yes, everything is limited, both your time, your resources, and how you treat your patient or who's coming into your door, versus we are in control of creating the culture, creating the community, and attracting the right people. And when we're thinking about expanding or scaling in different ways, it's about setting up yourself into that authority of you're the expert in that specific area. And sometimes if we're trying to do too much, it's hard to set ourselves apart. So I understand, especially you have been able to write a really bestseller book, and that has been having great success on that front and running your own retreats. So what do you see some of the best things that worked for you that you've been teaching other providers?
Well, so when you are multi-passionate and you're multi-hyphenate with a lot of background, how do you hone in your message? How do you hone in, at the end of the day, a doctor is a teacher? How do you do that in an effective way? and one that gets results for both your patients, your clients, whoever you may be working with. My most effective way, I think, one obviously has been seeing a lot of people. None of my patients have the same protocol. All of them are super personalized, individualized according to their blood work, and being open to seeing a variety of people. They're similar yet dissimilar. And when you get to see what those nuances are and what those differences are in the body, you can then develop even more refined programs. My business is all about cell care. Cell care is self-care. So my goal is for you to take care of your cellular health. And part of that comes with you. So what I've done is I've taken everything that I've been doing. I have packaged it into a book called The Anatomy of Wellbeing. And in there, I've pretty much told you exactly what I do on a client to client basis. But the feedback I'm getting from the book is that most of the people who have read the book also read a lot of other health and wellness books. And they're like, every page of your book gave me something that I could start doing tomorrow if I wanted to. So I've had people tell me they've read it once and now they're going back through it a second time to go, this is how I want to address my life. This is how I want to do this. And I've really taken the book from a perspective of, when I think of the word habits, I always think it has a negative connotation. Oh, I have this bad habit of doing this and I have this bad habit of doing that. So I've taken the idea of, all right, how can we take our habits, which for the most part, you can have some good habits, but they kind of go with this idea of being negative, and routines, which is something you might do. Like I might go to the gym, it's a routine, or I might, do this, whatever weekend activity that's a routine, but sometimes that can cause you to burn out. And placing your life into a more self-awareness, intentional pattern, and create rituals into your life that serves you better. So that's what the book is really doing. It's telling you how the human body works and how to build in personalized rituals to optimize your body. And so I basically spill everything, almost everything. There's a few things I had to take out of the book because it's so long, but at the end of the day, I want you to know and understand how your body works and how you can optimize that for long-term functional well-being and basically prevent and reverse disease, because it is a lot harder once you get a disease to address it than it is to prevent it.
Exactly. We know the most effective ways, especially my background before medicine, was population health. So the biggest thing we always talk about is habit changing is difficult. No matter whether you think the study say is 21 days or 2 months, whatever that number is, it's about how do we make a sense for us that we can do it consistently and easily, that adapt it into a ritual, right? A routine. And as something that we actually feel that we're gaining from instead of something we have to completely remove. So it's amazing that we have to be able to change that way of thinking. And I would totally recommend everybody pick up a cover of Anatomy of Wellbeing book. I'm sure you're going to be loving it, just like so many other readers have been. And so I know you both help the patient side, right, to optimize their health in these different areas on thinking how to reduce inflammation, how to really optimize both from behavior sense, culinary sense, and then well-being health sense. But you also train practitioners to adopt similar ways in their own practice. So how does that work?
Yeah, so I have my medical clinic, and then I have a group of community that I work with based off of my book, who are not my patients, but they're trying to address their habits and turn them into rituals. And then I also work with wellness business professionals in the Wellness Leadership Lab, and it's really about helping you hone in on all your passions and prioritizing what's important for you and building a very unique practice so you can be successful. So it's almost the anti-niche niche philosophy, because that can mean many things, right? When you're forced to niche down, but you're too passionate, you're like, how do I make this work? And I can tell you from somebody who is a very multi-hyphenate, you can make it work. And how do you incorporate it to, keep you stimulated, keep you happy, have joy in your profession? I mean, being in a medical profession, we've been through a lot of training, right? You don't just give up on it and go, okay, now I'm going to go real estate, which you can actually, if that's what you enjoy. But how can you build in and really go, all right, this is why I went into it, and this is what I can now do with it as we shift in our careers. And I think that's part of it, is in the medical profession, you enter, you get a job, and you kind of stay with that same kind of thing for like 30, 40 years, sometimes 50. You hit retirement and you're like, now what? But there's other ways to do it. And that's what I'm here to share with you and show you and kind of help you bring your best self forward.
Perfect. And really, we all know if we do it by ourselves, we can do it. It's going to take us much longer and much heartache to get into what I call the distraction zone, because it's not yet in our genius. We have plenty of things we do really well. So if we divert out, it can really be a distraction versus having a guide to put you in the right path to get you there so much more faster and less stress, and just a ease come into when you're expanding in this field. So definitely, please contacting her to get yourself in the right spot. If you're someone who really value patient care in a more holistic perspective of what we traditionally see with our medical practices. And I know everyone is leveling up, right? We all are curious to grow. So what's that focus for you at this point?
So leveling up for me, wow, what am I doing now? I think it's sharing the anatomy of well-being, sharing these practices, holding these retreats. I mean, these immersion events of just a few days, the transformation an individual can have and the impact you can have on them that then is tenfold, because they bring it back to their families and then they bring it back to their friends. That's wellness. That's healthcare. So that's what I'm doing. I'm just sharing the message.
Perfect. And for you, it's all about messaging. And then for us, I think that's what we can learn from you, is that we can talk about our passion. The more we do, the more we show up authentically. And that's what people attracted, right, to your message, to who you are as a provider, as a community leader in this space. And what about the future? What's the next few years look like?
The future looks pretty bright. Hopefully the second book, for the part that I cut out, will be out there for you. Just more events, more sharing, more retreats. I'm telling you, these immersion transformational retreats are very powerful.
Perfect. And I'm sure people are going to want to hear more about that. I appreciate you spending the time with us, and for all of us to learn from you and your amazing story and all the things you're able to do. And how can people get in contact with you? What's the best way when they want to learn more about your methods?
Yeah, so I'm at my website is drbhanote.com, so DRBHANOTE.com. I'm also Dr. Bhanote on social media, on LinkedIn, Facebook, Instagram. So keeping it really simple, just my last name, you'll be able to find me. There isn't another one.
Perfect. Yeah, keep it simple, keep it direct, right? Keep it brilliant. That's what I always wanted everyone to get into. So we appreciate your time. And I know everyone, you can be doing anything and you choose us to listen to us. So we appreciate you. And you found this episode helpful. We would love for you to pay it forward to other people, other healthcare leaders in your community by sharing it with them. Until next time, bye-bye.
Thank you for listening. Remember, the positive change we're seeking starts right here with me and you. If you are a fan of the show, or if you are just having struggles or success that you're either experienced in the past or are experiencing now in the healthcare industry, these matter to all of us. I want to hear from you. Visit SabrinaRombach.com/connect and send me a direct message. Talk soon!